Hello, good evening. I am Loreto Carmona. I'm a rheumatologist and epidemiologist from Madrid, Spain. And I happen to be the Congress chair for this 2021 EULAR, not in Paris, sorry, virtual, and also the chair of the Advocacy Committee. I'm here to tell you what we have in the program. Very interesting. We have the EULAR recommendations. So first, I'll explain what a EULAR recommendation is. Basically, we have a problem that needs some clarity, that needs to gather some evidence and to make clear that we do not have an unwanted variability. That means that everybody behaves the same under the same conditions. That is good for the patients, and that is good for the rheumatology community. So how do we decide to have a EULAR recommendation? So first, we start with a task force. This task force is basically somebody who has noticed that there is a gap in the practice, or there is too much variability in the practice of some medical problem. Let's say it can be a disease, but it can also be a cross-sectional problem, say, for instance, adherence. And they have realized that not everybody is doing the same thing. Okay, so they prepare a proposal, and they define who will be part of that task force. Usually there is a convener and there is a methodologist. I am methodologist in many task forces. And then they have a fellow or more than one fellow who will do all the literature review. And then they have the members of the task force. These members have to include all the stakeholders in relation to that problem. Can be a disease. For instance, they have rheumatologists and other specialists. For instance, I, if in spondyloarthritis for a uveitis, or maybe a lung doctor, or some others. And also, we have to include other health professionals, not only physicians, like nurses or physiotherapists or psychologists, depending on the task force. And finally, and the most important of all, these task forces have to include people who live the experience. So that means patients. In EULAR, we are very strict, or at the same time, very open to this, what we call the three pillars of EULAR, which is the rheumatologist or scientist, the health professionals other than rheumatologists, and the people with the disease. And we want to include all of them in all the activities that we do. Okay, so once we have the task force completed, we have the proposal is submitted to the EULAR Council. And this EULAR Council says whether there is a justification to do the task force or not. If the Council says yes, there is a point to do it, then they usually have the same process. They have a first meeting where they present the justification, all the methods that they're going to follow, and they reach an agreement as to what will be the users, the scope, and the structure of the document. Then, during a period of months, they collect all the evidence that is needed. Many times, this evidence will be systematic reviews on questions that are important in order to fill all the points or the recommendations that will go into the document. But some of the times could be a survey, for instance, to know how is the practice, a specific practice in Europe. And other times is specific studies, for instance, when they are studying the field of biopsies or synovial tissue, specific studies to provide more evidence. Okay, so after this period, the whole panel, the task force, reconvene. And then in this second meeting, they present all the evidence, and they have a preliminary recommendations proposed by the convener or the steering committee of the task force. And then they discuss all these recommendations or points to consider, and they have them all prepared for voting. After this session, they will vote in 1 or 2 rounds, depending on how complex these recommendations are. And then at the end, we will have a full document that sometimes or many times is published in the EULAR journals, but it's not necessary to do that. But we also get some other materials as a product. We get a slide deck to make it more easy for the dissemination of these recommendations. And we also get lay versions, which are very important for the dissemination and the understanding of the patients. And yes, basically, this is the EULAR recommendations. The number of them depends really on what are the needs of the community. And after a break, I will tell you which recommendations are being presented at this Congress.
Since March 2020, we've had to adapt to home working, remote health appointments. Too often, we could only get support digitally. It was not possible to travel or meet friends the way we enjoyed before. We've missed the lack of personal interaction. The corona pandemic has turned all our lives upside down. We have to be aware that while many aspects of digitalization have been welcomed, for some people it is a challenge to navigate the technology. Especially for people with a chronic condition, it is essential that they are able to use the digital options that may improve their quality of life. At EULAR Power, we strive to raise awareness about the impact of living with RMDs. This is why we invite people to share their experiences. So thank you to all those who contributed to the 2021 Edgar Steiner Prize competition. I hope you all enjoy reading the essays as much as I did.
In what has been a very difficult year for everyone, EULAR Power is delighted that people with rheumatic and musculoskeletal diseases, RMDs, took the time to take part in our annual Edgar Steiner Prize competition. Each year, we set a team asking people to explore issues relating to living with RMDs. As the impact of the COVID-19 pandemic has persisted, the manner in which healthcare and support has been delivered has changed significantly. When we set the topic, we did not realize how truly resonant the theme "How Digital Solutions Benefit My Life as a Person with an RMD" would be. I'd like to thank the judges who gave their time voluntarily to read through every single competition entry. It is a task everyone always enjoys, but it comes with big responsibility. The jury was united in choosing Stine Bjork Rondon Jeffson's essay as our 2021 winner. A description about feeling connected resonated with everyone. Enjoy reading the 2021 entries. I know I did.
Hello again. EULAR recommendations are a very important part of EULAR. They talk about all the topics that are important to people with RMDs. And we have many recommendations being presented at this 2021 Congress. We had a session on the first day, on Wednesday, in which we review a few of the recommendations. Precisely in that session, we review 2 recommendations related to the COVID. One was on how to manage people with RMDs and COVID from the infection to the management if they had any complication. And then we also had another COVID-related recommendations, which is about the pathophysiology and the different therapies that are being used from a rheumatology perspective. So these, of course, were last-minute recommendations that we had to develop and establish because of all this pandemic and all the problems that were going around with some of the medications that people with inflammatory diseases use. Then we have two recommendations that are more related to basic research, and that is one about how to measure interferon assays, and another one on what are the requirements for biopsy, for synovial biopsies. These seem very far from what from our understanding or for the patient's understanding, but they are very important in order to have the same standardized practice everywhere. And then we have recommendations in collaboration with the ACR, which are recommendations on different autoinflammatory diseases. On many of these diseases that were presented in yesterday's session were diseases that occur in children, but then they are carried over to their adulthood. That means that adult rheumatologists also need to understand what are all the important features of these diseases, and of course how to manage them, because they can get complicated with the long term. And these are diseases like the type 1 interferonopathies, IL-1 mediated, and also macrophage activation syndrome. So these are still in the go, and they are very important. And the last recommendation in which I really enjoyed was the EULAR Task Force for the evidence base and need for the EULAR Women's Network for Clinical Academics. That's the gender recommendations. And they made the point that women perhaps are not as well represented in the academia or in the congresses. So that's for us as men. For instance, when we have to choose a speaker, maybe we always think about the same men and we never think about a woman with the same quality. So these are the recommendations that were presented in that session, but we had many other recommendations along the Congress. For instance, we also have in the Congress the recommendations on work and RMDs, and these are very important because they are policy recommendations. So it's not only what we can do as rheumatologists, but also what we can tell the authorities, what we can tell the employers. So I think this is very, very critical, very strategic for EULAR. In fact, we have a session on work, please don't miss it. Then within the previous Standing Committee of Clinical Affairs, now within the Quality of Care Committee, we have some presentations. This is a session on what is called EULAR projects. And we have many recommendations there, one on a new activity score for Still's disease, which is a very new score, and that's the DAVID project. Then we have recommendations on how to conduct clinical trials in individuals at risk of developing rheumatoid arthritis. Then recommendations for cardiovascular risk, management of difficult to treat array. In another point, how to do the drug monitoring. So that it means all the whether we have to measure the drug. This is mainly happens with biologics, whether we have to measure in the blood to check whether the levels are okay, and whether we have to measure also antibodies. And finally, in this session, that will be well, actually today. It's been at 1:30. They also look at the points to consider for the assessment of competencies in rheumatology training. So you see that the spectrum, it's very, very varied. And then we also have tomorrow, June 4th, we have the imaging recommendations. Some are about the reporting on how to report studies that are related to ultrasound studies, but also how to use imaging to guide procedures, and also how to actually do standardized procedures in pediatrics, in children. And also on Saturday, the last day, the one that I think is the greatest of all is recommendations for the implementation of self-management strategies in patients with inflammatory arthritis. I hope you enjoy with all the recommendations that are being present in this Congress. Remember that you can also watch them until July 5. I'll see you in a minute.
I am Jeanette Anderson, and it has been my pleasure and honor to lead the Steiner Prize Jury Competition 2021. It is exciting to be involved in such a meaningful exercise where people with RMDs can share their personal stories. It's amazing to be given this opportunity, and each jury member found it inspiring to be given such an honest insight into people's feelings, experiences, and hopes. It is such a worthwhile competition as the essays help to open people's eyes about the reality of living with RMDs. I can only encourage as many people as possible to enter the 2022 competition. I am Jeanette Anderson, and it has been my pleasure and honor to lead the Steiner Prize Jury Competition 2021. It is exciting to be involved in such a meaningful exercise where people with RMDs can share their personal stories. It's amazing to be given this opportunity, and each jury member found it inspiring to be given such an honest insight into people's feelings, experiences, and hopes. It is such a worthwhile competition as the essays help to open people's eyes about the reality of living with RMDs. I can only encourage as many people as possible to enter the 2022 competition.
Osteoarthritis is a very common problem. It can affect any joint in your body, but also joints in your fingers and in the base of your thumb. Osteoarthritis is more common in people who are 45 years and over, but younger people also can suffer with osteoarthritis. The exact cause of hand osteoarthritis isn't known, but we know things like genetic factors, the jobs people did, any previous sports, injuries, and sometimes pre-existing medical conditions can all make people more vulnerable to having osteoarthritis. So medical understanding of what osteoarthritis is changing. So it was traditionally thought of as wear and tear or damage to the cartilage, which is the material that covers the end of joints, letting them move over one another. But now we know that osteoarthritis affects all of the joint, not just the cartilage. And actually it's a process where the joint is trying to repair itself. But in some instances, for example, bone can overgrow. And so in the case of hand osteoarthritis, if bone has overgrown, you can see nodules of bone around the joints. So now we really view osteoarthritis as wear and repair, not wear and tear. X-rays are not always needed to diagnose osteoarthritis. So healthcare professionals can work out whether somebody's got osteoarthritis by asking.
Hola, hello. That was a little bit more than a minute, but no problem. I wanted to share with you some what was my experience with these recommendations and task forces. I think it's a great experience, and I really recommend you to join a task force if you can. If you ever had the chance to join one, you can do it. In fact, with the new EULAR statutes, you can pose yourself, you can put yourself forward to enter a task force. And I really, if you ever get invited, please go, because it's really advisable to do so. So I've been methodologist in plenty task forces. That's mainly my role, but I've also been a member of task force, just plain member, which is so relaxing because I just have to, express my opinions freely and my experience and share with the others. And I've also been a convener in the recommendations for adherence. And of course, when you are convener or methodologist, you have to work a lot to supervise the fellow who is doing basically the full thing. They have to review all the literature, and you have to take a lot of decisions. So for the convener, it's a lot of stress, to be honest, but it's also very rewarding, because most of the people who works for these task forces are well, all of them are volunteer, but they are so generous with what they do. They respond very fast to all your emails. I'm not very used to that in my projects, and they are eager to share whatever and to improve what you're doing. So my experience has been incredible. And also, from a methodologist point of view, if any of you are interested in becoming a methodologist, for instance, if you are young and you are interested in the epidemiology field, in the methodology field, you can get trained. Actually, you just try to network, and it's not very difficult. Just ask anybody, and then you will get trained. And after a couple of task forces, you can become the methodologist of a task force. But what I was saying is that I'm learning with all of them, because, for instance, I was not an expert at all in Mediterranean fever, familial Mediterranean fever. But when I joined this task force, I learned so much from each one of the members that I now I can say that I know much more of familial Mediterranean fever than some of my colleagues. I'm just a methodologist. So, and then you learn from the patients a lot. And of course, not in times of pandemics, you get a lot of connections, which is what we are here about. So if you have any questions, remember, you can always ask. Join the EULAR network. You have a lot of networking here prepared for you in this Congress. You can also access my Twitter. You can try to reach all of us. Use us, because we are here to service you. And I hope you join some task force, and I hope you enjoy the recommendations, and I hope you enjoy the Congress. Thank you.